Juan Dangond, who's focused on making healthcare more personalized and affordable for everyone. So, welcome and thank you, Dr. Dangond, for being here.
Thank you for having me.
Such a pleasure.
Likewise. Been looking forward to this all week.
That's great. That's great. Well, we're happy to have you. And to begin, first tell us your journey.
Yeah.
How you got started into the medical health business.
Sure. Like most young doctors, our calling happens at different times in schooling. For me, it was 10th grade. I was challenged by my anatomy teacher to be the best and to learn the most and to fall in love with what you want to do. And, anatomy is a far cry from regular medicine, but that was the first time I was introduced into something like that. So fast forward a couple years, I'm going through college. I knew I wanted to be a doctor already. I got accepted into medical school. I became a DO, which we can talk about later what that means.
Yes.
And then I chose family medicine because it's the most all-encompassing of the primary care specialties. So we get to treat everybody from birth all the way till their death. Some joke and say from womb to tomb. But it's everybody, right? So the beautiful thing is getting to know the husband, the wife, the children, if there's an aunt or a grandparent involved as well, and kind of seeing everybody in the, in the grand scheme of life, right? What the family structure is like. And so, learning about their family histories and things of that sort. So that's how we got to today.
So that's a very interesting journey. So tell me about what is Dangond Direct?
Yep.
What is this?
Sure.
This is something new that you're doing.
It's something new that a lot of us are doing. The simplest way to understand what direct primary care is a simplification and a decluttering of the doctor-patient relationship. And at its core, what you're doing is you're offering affordable, accessible, and availability to yourself to anybody. Some might describe this as concierge light or concierge for everybody. A lot of people, the word concierge leaves a different taste in their mouth depending on where they're hearing it, right? For a lot of people, concierge means a place I'll never be able to be a part of, right? Because it implies a high annual fee, very exclusive, only for certain circles, as some might see it. And so direct primary care was a concept 20 to 25 years ago that a couple of primary care doctors got together and founded. And so it's simple. So basically for a different monthly price, you tier it however you'd like. Some people like to do different tiers. Personally, I'll be doing 2 different tiers for adults, age-based, and that's it. And so for that monthly price, everything that can be done under the roof or inside of the office, we can get done. What does that mean? Consultations up to an hour, right? Getting to know somebody, not just talking about their numbers going up or numbers going down, or your elbow hurts, and so you're going to go off to go see I joke and I say the numbers up doctor or the numbers down doctor, right? So right. The specialist, right? And so that's what we do is we're trying to just give people that relationship back with the doctor. So you can see me today, you can see me tomorrow. It's a smaller patient panel, so I can focus more of my attention and my efforts on those patients that I'm seeing. And it's a growing movement. So, a lot of people are worried about the primary care shortage, right? So a lot of primary care doctors are either leaving primary care or students are not going into it because they're terrified of the current system of the job. And I'll pause there so we don't go too far into that unless you'd like to. But
no. I mean, I when I think of primary care, I
yeah.
think of you go to your primary care doctor. You go once a year.
Yep.
They basically check you.
Yes.
They do your blood work.
Yep.
And then they send you off to somebody to, if you have a problem or you have an issue. That's the way I look at primary care.
Exactly.
And sometimes they have various people or other doctors within that care. And obviously your insurance covers your once a year treatment. So that's what I wanted. Like, what's the difference?
So let's go there then. Yeah. So, and for a lot of people, that's fine. This is simply an alternative. Okay. Depending on your medical circumstances, depending on, your anxiety levels as an individual, or your curiosity levels, really, that 1 a year visit with your doctor might not be enough. And what I often tell medical students or residents that are, choosing or aspiring to become primary care doctors, I often tell them, I say, remember that you didn't go through 12 years of this, just to spend 5 minutes with 35 people a day.
Right.
What's the point at that point, right? I mean,
Right.
sure, it's like this, like I think the famous analogy is, a master painter can make a painting in 10 minutes, but it took him 10 years to be able to do that in 10 minutes, right?
Right.
So one can argue that, hey, a doctor should be able to get the job done in 5 or 10 minutes, the job, but not the profession, not the true medical experience.
Not really taking care of the patient.
Exactly.
Giving the patient the time they need.
Exactly. And so this has been a deterioration of the specialty of primary care that's been happening for a long time. People have now grown accustomed, much with how nonchalantly you mentioned the way it is, which is I see them once a year, and if I need to go to a specialist,
right,
I go to a specialist, and that's all fine. But your primary care doctor has been trained to take care of 90% of most of your medical problems. And so how nice would it be to have a doctor that has the time to think about your problems, has the time to create a plan, spend time with you, and avoid going to a specialist if it's avoidable. Sometimes it's inevitable. But
so let me ask you, is it just, will there be other other doctors there? Is it just you, or are there other types of somebody there taking your blood, somebody there if you orthopedically, somebody like a psychologist?
Sure.
Or is it
great questions? So a lot of primary care, a lot of direct primary care offices, they try to keep it small. They try to keep it, comfortable and almost homey feeling, right? So the idea is not to become as big as the rest of the corporate offices or the larger groups.
I love the word corporate.
I have to say
really what it is.
It works, right? Corporate works because corporate has a structure. But a lot of us in primary care find that the corporate structure or the corporatization of medicine is what's led to this response, right? A lot of doctors are unhappy with the way that they are taking care of their patients, and a lot of patients are unhappy by the care they're receiving. And oftentimes, back in the day, I mean, in the times of my great grandparents or even my grandparents, if you ask them who's your doctor, they'll say the name without hesitation. Right. Nowadays, who's your doctor? They have to look at their insurance card. Nobody knows.
No one knows. That's true.
Right. So and that's what this is all about. This is all about reconnecting and getting back to that coveted doctor-patient relationship, which is where a lot of healing takes place. And that can't happen in 5 or 10 minutes. But to answer your question, I'm sorry I've diverged a little bit.
No.
The idea is not to become a big monster, gigantic group. But you can expand horizontally, right? So what does that mean? That means that I can hire another doctor, and now there's 2 of us, right? But the idea there is that hire needs to embody what direct primary care is trying to do, right? It's not about increasing patient volume numbers. It's not about increasing revenue. It's not about the transactions that happen behind the scenes of every medical visit. It's simple, transparent, once a month pricing, and you get your doctor for up to an hour whenever you need them. Not whenever you need them, meaning within business hours, Monday through Friday, but also, being available to people. Once a doctor and a patient get to know each other, it's fascinating what happens when there's a trust and there's a bond that is generated, right? So I'll say to my patients, I'll say, listen, if it's an emergency and you're calling me on a Wednesday at 11 o'clock at night, I'm going to pick up the phone because that's the promise I've made to you, right? But vice versa, the promise that you're making to me is that you're only going to call if you really do feel like it's an emergency. Otherwise, you know that at 8 a.m. tomorrow, we'll be on the phone together. And that's very hard to find nowadays, right? People can't get into their doctor's offices for 3 months at a time. So they end up in the ER or they end up in the urgent care where they're going to be taken care of, no problem.
Right.
But it's by someone that doesn't know them and someone that doesn't know their entire chart or their entire history. And so that's where we're losing that personal touch. And that's what this is looking to bring back.
And so what does something like this cost? Is this covered by insurance or no?
No, and that's the big distinction. So what we say is we take all insurances, we just don't bill your insurance, right? So this is it's a direct relationship. It's a one-time payment between the patient to the doctor, and now the doctor works for the patient instead of for the insurance company, which is another big thing that a lot of people don't really understand is that nothing wrong with insurance. Insurance is necessary, right? We all have to have it. It's like your car, right? I don't know, let's assume you have Geico, right? Would you ever think of calling Geico when your headlight goes out? Seems ridiculous, right? You wouldn't call Geico for a tire change. You wouldn't call Geico for an oil change. You don't call Geico when your car gets dirty, which is to say that the things that keep the car running, you take care of, right? Because the market is there and it's relatively affordable.
Right.
But when a big accident happens, you call Geico.
Right.
Somewhere along the way, health insurance stopped being that, and it became this micro-transactional coupon book, as I like to explain it to people, because that's what it is.
100%. Yeah.
You go somewhere, you go to get your labs drawn, right? You show them your insurance card, and
Yeah.
that insurance card is effectively acting like a coupon book. Sure, a coupon that you're paying once a month to have, but nonetheless a coupon book. And then there might be a copay, and then there might be an adjustment that comes in 3 months later in the
Right.
mail. I mean, I can speak personally as well. I had an ultrasound taken of my abdomen, and I paid $10 that day, but three months later I got a bill for $150.
But if you did that ultrasound in the hospital, it would have cost double,
which
quadruple.
You're absolutely right. And that's what this, again, so that it all ties into, if you know you can talk to your doctor today or tomorrow, and you can see them today or tomorrow, you're not left hanging thinking, what do I do? I guess I got to go to the hospital, right?
Will you be able to do ultrasounds?
Yeah. So not myself, right? So to that
Okay.
point, what I've done is I've done a lot of legwork so far. So I've been in the community, I've called independent imaging centers, and I've said, hey, listen, I want to know what you guys have cash pricing wise, because that's the name of the game right now, is offer discounts on cash payment. You go to an urgent care, you go to an ER, there is also a self-pay discount,
Yeah, 100%.
which ironically
Yeah.
is actually just the cost of the services. So it looks cheaper when you go in and you ask for the self-pay cash price, but that's just the fair price. That's the market price.
Right.
If you look through your insurance billing later on, you're going to be shocked by the sticker price of what said place, whether it be an imaging center or a hospital, is actually billing your insurance. So that's a bigger problem for another conversation. But the bottom line is that
that's a whole nother.
That's a whole
the
mess,
insurance
right?
world.
But the point being is that a lot of people
Right.
are interested in taking agency over how they spend their healthcare money. So that, for example, a good example would be somebody that has what's called a high deductible insurance plan. A high deductible insurance plan means that they have to spend a large amount of money before insurance starts covering, right? But that plan comes at a lower monthly premium. So it's good for people that are in good health,
Right.
that hardly ever interact with the system, but want to be insured in case of an emergency. Well, somebody who has that type of coverage pairs beautifully with direct primary care, because they're already paying the lowest premium for an insurance that, like a car insurance,
Right.
covers the big stuff. And then you have $89, for example, if you're in the first half of my age group, $89 a month, and you have your primary care doctor working for you, for your interests, for
Right.
your goals, right? Today, tomorrow, worst case scenario this week. So you pair those two things together, and what the studies have found, because this isn't just me talking, this is studies now, they found that people are spending less healthcare money unnecessarily, right? An emergency is an emergency, got to be done.
Right.
But that tiny moment of doubt at 6 p.m. on a Wednesday, when you don't know if you should go to the urgent care or to the ER, or if it can wait till tomorrow, here comes DPC to save the day, if you will, right? Because
Right.
you know that your doctor will be there for you in the morning, and if you can, if you don't want to call them at night, that's your prerogative. But most of the DPC doctors have already said, if you have any doubts, please text. You will always have your message read. If not replied to that night, because it's after hours, it'll be replied to in the
Right.
morning. But if I screen a text or a phone call and it sounds like an emergency, I will get on the phone and tell that person what needs to be done, whether it be come see me tomorrow, or go to the hospital, or go to an urgent care, right? So a lot of the benefit is simply just that access, the availability
So
of your primary
there is
doctor.
a little bit of it is concierge.
Yes, it is. Yeah.
It's not, because what's the difference
Sure.
between what you're doing
Yep.
and concierge?
Excellent question. The biggest difference is the price, the access fee, if you will. But also a lot of concierge practices that call themselves concierge, they're double dipping. So they charge either a very large monthly or even larger annual fee, which is the access portion, that's the concierge portion. But every time you go to that office, they're still billing your insurance, right? So the DPC masterminds, the reason they chose to not bill insurance is one of honesty, one of transparency, right? So when you create a note and you have to keep track of what are called CPT codes or encounter codes and modifiers, and it's an alphabet soup of letters and numbers. I mean, that 5 minutes with your patient behind the scenes turns into a 20-minute, gold mining operation by an army of billers and coders that are trying to extract the most amount of money from that insurance encounter. And so a lot of us just, I mean, when I say we, the DPC movement,
You don't want
we
to deal
don't
with
like
that.
that. It's
You
not
want
even
to
about dealing.
practice
It's not about,
medicine,
yeah.
not
It's not just about not wanting to
right.
deal with it. It's about, you have to hire a literal army of people whose entire job is to scour your notes and dictation to see if you potentially missed a modifier code or an upcharge code so that the fee for service that was provided can be billed higher.
Right.
It's very muddy. It's a little bit corporate. It's a little bit businessy. And so in essence, this response, this going into direct primary care is simply saying, what are we doing? Let other people do that if they want, but we just want to work for our patients. So if somebody wants to come to the office and they won't be, I mean, these are high level concepts that I'm sharing with you because it's what drives DPC doctors into DPC. But for the patient, it's very simple. They're looking for a relationship with their doctor again. They want someone that they can trust, that they know will be there for them today or tomorrow, that is not looking at them like a bunch of codes and transactions and is looking at them like a person, right? So it's just going back to basics. I want to take care of you. And just like in any other business, you pay for where you're going or you pay for your subscription because it's something that you want to enjoy more than just once a month or more than just once every once in a while. And so this is simply just saying, let me work for you and only you, not for the insurance company.
So I'm a patient.
Yes.
Take me through.
Sure.
I join.
Absolutely.
What does that look like? Why am I'm seeing you. Now I'm seeing you for my physical once a year, but I'm calling you for everything and anything, which.
Yeah. That's so your once a year, the once a year visit is what we call the, your screening, your sit down, and talk about your health preventions. The reality is that once a year visit can happen at any time. It's there nowhere in the medical teachings do we get taught about everybody must be seen once a year.
Right.
We encourage at minimum once a year, but you're a patient, you've just signed up, let's say that you're in relative health, you have a little bit of high blood pressure and some cholesterol issues. You're not a high risk factor person for having a stroke or a heart attack, but my job is to keep it that way, right? My job is also to inform you, just like at your regular annual visit, that there are certain screenings for cancers that we need to do, that there are certain types of conversations that we need to have as you get into different age groups, different problems start to arise, and we get ahead of things. That's your annual visit, but we're going to talk about that at every visit because we have an hour to do so.
And then that person still needs to go to their doctor for their gastro doctor? Or?
Sure. Yeah. So for the purposes of procedural things, yes, the gastro is the only doctor that knows how to do a colonoscopy, screening it for cancer. The cardiologist is the only doctor that knows how to run a stress test, for example, to make sure that your heart is not beating incorrectly or not getting oxygen when it's under stress. Your dermatologist may be better trained than a primary care doctor to check your whole body for skin cancers, right? So there's still interactions that need to happen with specialists. But where the magic happens in primary care is that, again, most of your common day ailments, most of your day-to-day issues can be handled, should be handled by your primary care doctor. Because we don't know when we're going to wake up with a sore throat. We don't know when our ear is going to be buzzing. We don't know when we're going to get a cold, right? We don't know when we're going to twist an ankle. And so that's where primary care is supposed to step up to the plate, right? That's not happening. Because call your primary care's office today and tell you when ask them when the next appointment is, right? 3 months from now, at minimum. And that is a byproduct of having to increase patient volumes day to day, right? So a primary care office today is a assembly line of annual visits every day. The same thing, 10 minutes at a time, 35 patients a day. That's the job. That's what 12 years of training will get you to. And so I want to exercise my knowledge. I want to exercise my brain, right? And I want to do so for the benefit of my patients, not to the benefit of a code or a modifying, billing such and such. And that's what it is. So yes, you're going to get your annual screenings with me. You're going to get your annual visit. But for example, something happens. I say, hey, come in. I have room for you today. I have time for you.
Right.
Right. come on in this afternoon. I actually have a whole 30-minute slot available that I pre-planned for this very reason. And let's see what's going on. And maybe that sore throat isn't just a sore throat. Maybe that sore throat is the beginning of a much more sinister investigation that needs to take place.
Right.
That, God forbid, was in another scenario, you'd have to wait 3 months to get it looked at. You'd be slotted into an already busy day. Not that, you know, I don't want to downplay people that work in the system. It's just it's the truth. You just don't have the time to sit and really detail the situation. So what ends up happening is a very if-then scenario. If the person's throat hurts and it's been more than 3 days, then they should be on this. If the person's throat has been tingling for 7 days, then they should go to the throat doctor. And so you can see how this creates a backlog for even the specialists.
Basically cutting the urgent care out.
It's not, but it's not cutting it out. It's just putting it back in where it's supposed to be.
Right, exactly, and in a better way.
Exactly. So and again, these are the nuances that I think the people that have enjoyed direct primary care for the last couple of years can attest to, is that it feels good to have whatever problem checked out by the doctor that knows every little intimate detail about you. The one that's been there for the fractured ankle, the one that's been there for the first time your cholesterol got higher, for the one that's been there for the first time your chest had a tingle in it. And so you're comfortable. You're comfortable with this individual. You know they know you, and you know they're working for you. Now, don't get me wrong. There's a lot of doctors out there that are still practicing this level of detail and medicine. But those are the doctors that are becoming burnt out and disillusioned with the job as opposed to the career that they went into. And so those are the doctors that are contemplating leaving primary care, going into concierge or DPC or something else because they don't feel fulfilled. So
before, because we have a few minutes left, tell us the difference between a DO and what what's the difference?
Absolutely. A long time ago, it used to be a much bigger difference. Osteopathic medicine is what DO means.
Okay.
MD means medical doctor, but it stands for allopathic. So you have allopathic medicine versus osteopathic. Way back when, during the founding of osteopathic medicine, it was very much more focused on the bones. They believed that the bones were the cause of a lot of problems. This is also back in the day when people talked about draining your humors and such, right? Leeches and all that. Fast forward to, let's call it early 2020s, the differences became much less. So we get the same exact training. An MD doctor and a DO doctor, by the time they graduate, can prescribe medications, can treat complex medical problems, can perform surgery, can birth babies, everything the same. The biggest difference is that the osteopathic physician, during their 4 years of med school, also gets trained to use their hands. So we get trained in osteopathic principles, touching the body, learning anatomy in a very specific way, being able to perform manipulations if necessary, stretching of the muscle, repositioning of bones. We can even actually almost we can somewhat tap into what are called the sympathetic or parasympathetic nervous systems to decrease the mucus thickness during a pneumonia, for example, right? Wow. So it's a little bit extra. The biggest difference is we can use our hands as well, and it also gives us a different perspective, right? Because we spend a lot of time as students, quite literally, learning each other's bodies, the little parts of the shoulder that stick out, and what are they called, and what connects to there, and what comes out of where. And so when we look at somebody, we get a very holistic picture of them. I can't speak for what the allopathic, training is like because I never did it. But at the end of the day, your doctor is the same. Everything can be done exactly the same. We just have an extra set of training under our hands, basically.
That's amazing. Mm-hmm. Yeah. Well, I have a couple minutes. I want to wrap it up.
Yes.
Anything that you want to tell our viewers where your office is now? Mm-hmm. So tell us a little bit.
Yep. So my practice is called Dangond Direct. I didn't want to lose the alliteration with the last name. I'm located here in South Miami, the 7000 building. I think people know it. It's across from Larkin Hospital, next to Baptist South. And what we're doing is we're just trying to reconnect with the community. I want to be people's primary care doctor, and I want to be able to take care of them through thick and thin, health and not health, be able to link them up with the services that they need, just like always, but to be available, because being available and having time is what I value the most. And so that's what I'm trying to construct here is going back to the old school relationship where the doctor knows the patient trusts the doctor, and magic happens.
I think that's wonderful. I think that's
you.
what we need to get to.
Thank you.
Okay, well, thank you so much for being here today, and stay healthy.
Yes.
Thank you for helping us
Absolutely.
and helping our viewers.